Hi everyone, today I am going to discuss one of the important topic of community health nursing, that is home visiting. Home visiting is the backbone of community health nursing because in community health nursing we are providing care to the patient at their home only. Home visiting is also one of the very essential and important aspect of community health services because we can get maturity of the patient at, at their home only. The home is utilized for the many reasons in relation to the health of the family. A community health nurse who is providing services in the home requires technical skills, knowledge of preventive and therapeutic measures, teaching abilities because the main aspect of home visiting or if we are providing care in the community is health education. So a nurse should have teaching ability, judgment and a full understanding of human relation. So how we can define home visiting? So home visiting is defined as the delivery of specialized services in the home healthcare setting. It means that a community health nurse should deliver the specialized nursing care in the home of the patient. Second definition says that home visiting is the process of providing nursing care to the patient or family at their doorstep. It means that a community health nurse is providing nursing care to the patient and their family at their home. So, what are the purposes of home visiting? So, the main purposes of home visiting are protection against diseases by educating them regarding various preventive measures of diseases. Next point is providing essential treatment. On the basis of home visiting, we can assess the need of community peoples and we can provide essential treatment. Third point says that providing comfort and relief from pain to patient. Through the home visiting, we can assess that what are the factors that are uh, causing discomfort and pain for the patient and we can relieve them by various measures. Next point is giving a support and empathy to the patient and family. If any family member is having any long-term diseases or such as cancer or other diseases, so we can provide some support and empathy to them to release their stress and anxiety labor. Next point is using domestic equipment for the nursing. At the time of home visiting we are using domestic equipments because it causes less anxiety and stress for the patient because it is much familiar with the equipments. In hospital setting, if we are using a hospital equipment, they may get fear and stress, so the anxiety level will increase. Next is providing health education. Yes, during the time of home visiting, a community health nurse should use to provide health education regarding the various preventive measures, awareness regarding the family planning and control of many diseases. So the community peoples will improve their health status. Last point is giving as much respect as possible to the faith and belief to the family during the procedure. At the time of home visiting, we can give respect to the family members and we can give faith and belief also during the procedure, and we can gain some faith and belief also during the time of procedure. So let's see the important principle of home visit. So first one is planned and purposeful. Yes, definitely. Home visiting should be planned and purposeful based on the purpose and requirement of the community. The aim of visit should be clearly mentioned. For example, some purposes are survey and statistic, MCS services, home services in case of illness. Second principle is meet the need or based on the need of people. Home visits should be done according to the need of the people of family. Third principle is regular and flexible. Home visits should be regular and flexible according to the need of the patients. Home visits are conducted regularly, which helps for better cooperation of the selected family. In certain circumstances, the aim of home visit should be changed based on the need. Next principle is educative. Home visits should be educative because it gives excellent opportunity for health education and nutritional education. Home visit helps to educate the people in the community regarding health promotion, maintenance, and preventive and curative aspect. For example, health education on personal hygiene, nutritional aspect, family planning, immunization, prevention and control of certain diseases is can be done at the time of home visit. Next principle is demonstrate hygienic principle. So the home visit should give opportunity for nurse to demonstrate hygienic principles also. For example, we can take hand washing. Next principle is convenient and acceptable. So home visit should be convenient for the family members and it should be acceptable, not forced one. We cannot force them to accept this. It should be accepted by them only. So the principle is the nurse should make an attempt to include each family member while using nursing process. So if nurse is doing data collection and making a nursing process for an individual, she should include all the family members. Next principle is positive interpersonal relationship or good rapport. Establish good rapport with the family members, community leaders to understand the problem and collect the facts. Next one is the nurse must respect the patient choice. One of the major principle of home visiting is the nurse should remember the patient rights, such as the decision regarding treatment should be taken by the individual or the family members. Right for privacy, right for confidentiality should be included. Next principle is home visiting should be recorded in the diary and family folder. So she should record regarding the home visiting in the diary or in the family folder. So now I'm going to elaborate some of the components of home visit. We can say it as aspects, phases, process or steps of home visit. So the main component or steps of home visit are initiation phase, pre-visit activities, activities during home visit, termination phase, post-visit activities. So we will see one by one. So first one is initiation phase. In this phase, the community health nurses clarifies the source of visit and purpose of visit. So next phase is pre-visit activities. So in that before going to home, he or she, it means the community health nurse, must gather information regarding the home location, distance, address and population. Second one is first make survey and prepare a map of the area with details of topography, location of area, village, population, existing health services, number of schools, number of Anganwadi schools, water sources, etc. The information may be obtained from the family folder and she can obtain information from other nurses also. Third phase is one of the important phase is activities during home visit. So nurse should perform some of the activities during the home visit. So these are always carry the kit bag or session bag for home visit. Second one is on the first home visit, the nurse should introduce herself to the family members and must develop good IPR. So if she is developing good IPR, then only this family will cooperate and give the information to the nurse and explain the purpose of home visit, and she should explain the purpose why she is doing home visit. Third is the nurse should assess the family needs and plans the nursing care according to the needs of the family. Fourth one is encourage the individual to talk about her own or family problems by suitable questions. Nurse should encourage them to share their information. If they are having any problem, they have to share. Next one is providing nursing care. She planned according to the need of the family. After that, she is providing nursing care. For example, taking temperature for and for giving bath, Next is demonstrating and teaching. If they need any type of health education or any procedure demonstration, she should give. For example, giving insulin injection in community areas. Many diabetic patients are there, so when they are normal, they are home only. So she can demonstrate how to give insulin injection. Next one is making nursing diagnosis and tentative nursing care plan. Okay, next is establishing priorities. After diagnosis, she has to prioritize the problem. After that, only she will plan for the procedure or care. Next one is advice hospitalization if required. If she is after diagnosis and she find that any major thing is there, she can advise for hospitalization. And if active immunization if required, if immunization is required, she can give. Next one is give health education on personal hygiene and environmental hygiene. Next one is advise mother on nutrition of the children. These are the some points that a nurse is, or some points or activities that a nurse should do at the time of home visit. Next one is our fourth type is termination phase of visit. Termination of visit occur when it means when the nurse can terminate the relationship or home visit when nurse patient goals are reached. If the goals are reached, then she can terminate. A patient change his residence. If a person is changing his home, so she can terminate. The nurse transfer from patient care to other nurse. If other nurse is appointed for that area for home visiting or providing care, so nurse can terminate the home visit. Next one is fifth phase is post visit activities. Post visit activities include recording and reporting. It was the last phase now, so in that the nurse will do recording and reporting. If any problem in the family, the nurse may discuss with the health team members. If she is finding any problem in the family, the nurse may discuss with the health team members. Next one is analyze the activities and community resources available to the particular community. After that, the nurse can analyze activities and community resources available to that particular community. Next one is prepare for next home visit with comprehensive plan to meet the goal. And after that, she can plan for next home visit with comprehensive plan to meet the goals. So these are the some of five phases of or five stages of home visit. So now I'm going to elaborate some of the problem that is encountered during the home visit by a nurse. So first one is consumes lot of time and energy. Definitely home visit will take lot of time because the nurse has to uh, travel and reach to the home, and distance is also one of the reason of more time taking, and she has to plan and she has to maintain good IPR, and after that procedure health education, so it will take lot of time and energy also. Second one is unforeseen events. Definitely nurse is not knowing about that area, and so that area will be new for the nurse, so this problem will occur. Next one is not acceptance. If family members are not accepting that care, so it will also one of the reason for not good home visit. Next one is role of problem of local language. If nurse is not knowing about the local language of that particular that area, so it will also cause a problem. Role confusion. If nurse is confused with his or her role, so it will cause a problem for or problem during the home visit. So moving ahead to role of community health nurse in home visiting, mainly home visiting is done by the community health nurse only. So all the activities should be fulfilled by the nurse only. So some of the major points are recording the history of family to ascertain the cause and duration of illness. Nurse is recording the history of the family to know the cause and duration of illness. Means if any past history of diseases, so she can find out. Providing treatment and related care. She can provide treatment and related care, demonstrating the nursing position procedures to educate the family members. She can demonstrate the nursing procedure and educate the family members, such as giving insulin injections. Next one is giving medicine as per the standing order. and she can provide essential nursing care in grave situation. It means the nurse can provide medicine in critical conditions. For example, if any pregnant woman is having eclampsia, so nurse can give management, early management. After that, she can refer the woman, and she can also provide essential nursing care in the grave situations. So next point is supervising the nursing procedure provided by family member. If any patient is having any critical condition and she is staying at home, and family members are providing care or nursing procedures, so a community health nurse can supervise them. Next point is including the patient himself in taking care of chronic illness. If patient is having any critical condition, so nurse can encourage them to do self care, and she is also giving psychological support to them. So these are the main points or role of nurse in home visiting. So this is the topic, our topic, home visiting. I hope you all are understand. It is one of the very important topic in community health nursing, because uh, we are providing care in community